Hello, everybody. Welcome to the Healthy Enterprise Podcast. If you're a return listener, thank you for coming back. And if it's your first time, I hope you enjoy this episode. I'm going to be speaking with Dr. April Joy Damian. She's an epidemiologist and health services researcher with deep expertise in health equity, psychiatric epidemiology, and the social detriments of health. She is the Vice President and Director of the Weitzman Institute, which is a national research, education, and policy center that is focused on transforming primary care for vulnerable populations. You thought that was easy to say. Well, she's going to tell us more. So please welcome Dr. April Joy Damian. So April Joy, hello. Thank you for joining me today for this episode. I'm looking forward to hearing about yourself and your professional career and the company you're working at.
Great. Thanks, Heath. Thanks for having me.
Well, why don't you start off by, telling our listeners a bit about yourself and the role you're playing right now.
Great. Yeah. So I'm Dr. April Joy Damian. I go by April Joy or any version of what I just shared earlier. I'm trained as a psychiatric epidemiologist, which means I focus on mental health of populations, largely in the child and adolescent space. Also trained as a researcher and public health professional. I currently oversee the Weitzman Institute, which I'm sure, Heath, that we'll get into in a bit, where we focus on a national level on research, education, policy in the safety net primary care space.
Interesting. Okay. Well, why don't you, while we're at it, why don't you elaborate on that? Like, tell us more about that space because it sounds very interesting and how it fits into the big picture.
Yeah, so I'm very proud of the work that we do at the Weitzman Institute. I've been here for a little over 6 years. I'm based out of our DC office. Our headquarters is in Connecticut. So our focus is really to ensure high quality, effective, and accessible healthcare for all. And we do that through research, education, and policy, right? So we work with both public and private partners, ranging from providers, payers, healthcare systems, and industries, as well as government agencies, foundations, nonprofits, as well as academia. So really wanted to make sure it was really came from the idea of Dr. Margaret Flinter, where so much of research back then, so back in 2007, and I would argue up to today, continued to be done primarily in large academic institutions, and seeing that a lot of the research that was conducted, from the principal investigators to the research questions, as well as the evidence that was being produced, was not necessarily reflective of the needs nor the priorities of federally qualified health centers, which serve 1 out of 10 Americans across the country. And so really understanding how do we have more research that is representative of the needs and priorities of the health center workforce and the populations they serve. And similarly, having that overflow to education as well as policy. And so that's really the work we do. We touch over 2 million patients through our partnerships with federally qualified health centers and other safety net primary care health systems across the country. And so really excited about the work that we do and so proud of our team at Weitzman.
Maybe why don't you elaborate maybe on those partnerships and how you're actually impacting individuals?
Yeah, so partnerships can form in different ways, right? Some come to us by way of organizations and some by individuals. And so some organizations are really, and I would say primarily healthcare systems or including federally qualified health centers, might be really struggling with, say, high rates of uncontrolled diabetes or cardiovascular disease or childhood trauma, right? And seeing, so much with health centers operating on what we call a shoestring budget, right? Talk about efficiencies and serving the populations that are most in need and likely have the most limited resources, right? And saying that there's so much we want to do to support the infrastructure, the front lines, and improve patient health. But we really don't have time to review the latest evidence that's out there in terms of innovation. We try to figure out the education piece because what we're seeing that's out there is not really necessarily relevant to our practice. And so can Weitzman, given that we were founded out of an FQHC in Connecticut, right? close to 20 years ago. We'll be celebrating our 20th in a couple of years.
Maybe,
Came
what does that acronym stand for? The FQHC.
Oh, federally qualified health centers. Sorry.
Okay,
So
good.
it's a designation, particularly focused. Thanks, Heath.
No problem.
Being in DC, get caught up in acronyms and alphabet soup.
Yeah.
Yeah, so federally
There's a
qualified
lot of them
health
out there.
centers. Yes, yes.
I'm never afraid to ask because I'm speaking on behalf of the listeners. So it's like,
Yeah,
well,
no,
if I
it's
don't know
a
what it
great
is, I
question, Heath. Yeah, sometimes I forget. I just get caught up in the alphabet soup. We have federally qualified health centers, which serve 32.5 Americans. That comes out to 1 out of 10 Americans, including 1 out of 8 children under the age of 18, right? Lots of veterans, persons experiencing homelessness. And so, really understanding how do we go to a trusted entity, i.e., Weitzman Institute, um,
hmm
to understand the latest evidence base, to be trained in evidence based programming. So, through our Project Echo, our learning collaboratives, our quality improvement, or QI coaching, right? To really understand how do we do better in addressing some of the health challenges, Heath, that I mentioned. And so that's really how we partner with them. Sometimes it's also, and so I talked about the programming, sometimes it's doing a needs assessment and seeing, okay, this is your understanding, but is that really reflective of what your workforce is seeing, like
hmm
your patients, right? And so sometimes there's a part of being a neutral convener and thought leader that we play in these spaces of like, let's make sure what you're thinking or the conclusions you're coming up with is actually informed by the stakeholders that will be affected by these decisions, right? And so
hmm
sometimes we've also played that role, and that's where the neutral convening part comes into play.
Okay, and where does your role fit into this?
So I
What do you do
oversee
on
the
a
whole institute.
the whole
Yes,
thing?
the whole thing, the whole enchilada. So yes, research, education, and policy are all part of the Weitzman portfolio. I have
Right.
amazing leadership that I work with at Weitzman who oversee those respective portfolios, um, inclusive of work that we do in innovation that is cross-secting across research, education, and policy.
What was it about this organization that attracted you to it? Because you were in another place prior to that and a few other places along the way. So, what attracted you to this organization? What was it that drew you to it?
Yeah, first of the mission, right? Like for me, I knew early on, or I was exposed to really reflecting on what is my purpose in life, right? I remember attending a retreat at the age of 8 through church and really exploring like how can I be of greatest service to the world, right? And so I was an old soul even as in grade school, right? And so really understanding, for me, I really want to alleviate human suffering, right? I want people to be able to live their fullest lives, not just in terms of living long, but also aging well and having great quality of
hmm
life from the time they're born to the time they lay their head to rest, right? And so, really inspired by the mission, right? And seeing the mission of our organization is aligned with my own personal mission and how I think I could be of greatest service and contribute during the time that I have here on earth. And so that's the first thing. I think the second, and is a close second, I would say, are the people, right? To be able to work with people and leaders. So our founder emeritus of the Weitzman Institute, Dr. Margaret Flinter, but also our parent organization, um, Mark Maselli, who's the CEO and founder of Moses Weitzman Health System, under which Weitzman Institute lives under. Really seeing how committed they are, genuinely committed to this work, right? Like, um, and to know that it's not just during work hours that they're committed to this work. It's not just because it's the hot topic of the day,
Right.
but genuinely care about the mission, about the work, rain or shine, about the people that we work with. And so I think being able to work with such visionaries who really care about the people and the work is really important. Um, and I would say the third is And with that, of course, is like our own team, which I keep, you know, saying that. And so I won't belabor that part. And I would say the third is seeing the impact, right? And so one of the areas in my life, that I think will be a lifelong um, lesson that I'll need to work through, is a work in progress, is patience, right? And I'm great at delayed gratification. I've gone through years of school, but sometimes you just want to see the impact of your work.
Yeah,
Right? You want to make
absolutely.
sure, like, is this even making a difference? Just to keep keep it going, right? Because we work on very difficult issues, right? From making sure that those on the front lines, whether it be in rural Appalachia, the South, or in urban cities like Chicago or Baltimore, have access to quality care, right? Like, so childhood trauma, uncontrolled diabetes, like I mentioned in the beginning of our conversation. So sometimes you just want to win, right? And so
Yeah.
hearing the stories from healthcare providers, right? And that's across medical, dental, and behavioral, getting to meet patients and their families who've been touched by the work that we do, whether they were the patients of providers who matriculated through our education programming, or they themselves participated in our advisory boards or part of our research, just to know that we've touched their lives and you're like, you know what, like it's really meant a lot to be seen by you and to know that you care about my well-being, right? Like I don't know these people
Hmm.
from Adam, but to know
Right.
that there are people like us who want better for everyone. And like,
That's interesting. And because some of these issues are very large, heavy, slow moving for change. And so it's no surprise that you're like, is this working? You know, like you say, like, is there some evidence on the effort that we're making, and what is the outcome? And so you kind of said, it's the evidence is in those little stories about individuals. And are there any of those stories that have touched you more than others, that maybe you'd like to share, that sort of gave you that reinforcement, and that sort of like, this is why I do this?
yeah, so I have many stories. Um, but I'll mention a more recent one. One of our most recent projects was a restorative justice mindfulness project
Mm.
to working with youth who've experienced trauma. And so we had piloted this project in New Britain, Connecticut, where there's a lot of socioeconomic challenges. And so the feedback we received, right, because you're essentially exposing youth, it's over 10 weeks, right? And then you would, it's a typical classroom. You would see like the cool kids, right? I'm putting in air quotes, but just think of like what
Yeah.
it was like to be in that age, right? Like middle
Yeah,
school, high
that peer
school, right?
pressure and that kind of thing.
Right. And so
Yeah.
you have the cool ones, the
Yeah.
quote
The
unquote
clicks.
outcasts, right? You
Yeah.
have your cliques. And then some of them, the cool kids, are saying, you know what? I would never pay attention to that kid in my class. And now I feel like I can say hi to them, right? Um, and so that sense of community, because you have to remember, like these young people also went through school during COVID, right? And so they went years, part of,
Mm-hmm.
in such crucial developmental years, having not had that physical interaction with
Mm-hmm.
their peers, classmates. And so to know that they're able to build community in such a short period of time, right? Learning social skills, but also emotional regulation, right? Some of them had said, you know what? Whenever I would get angry, I didn't know how to necessarily deal with that, right? Because they've just really been exposed to more aggressive behavior, right? Whether that be yelling or avoidant behavior, I'll just like not talk with the person, but to know like, hey, I can have a conversation and talk through, difficult issues with someone if I really care about them. Or maybe I just need to
Mm-hmm.
take a beat and like take a few breaths and recollect myself, right? And so
Right.
to know they were able to do that in such a short amount of time, right? 10 weeks, and to know that these are skills that they could learn that will take them not just through the remainder of their grade school, but also beyond in adulthood, right? Because we know Even in professional settings, there can be frustrating moments where
Oh yeah,
sometimes it's best
absolutely.
to take a breath, or make sure that one
Pause.
is
Yeah.
calm and collected before sending out that email, or just outright avoiding a colleague, right? And so
Mhm.
just really to know that, and then to also hear from their parents, right? We also have heard from some other parents and caregivers who said it really meant a lot to have a place where my child could go to after school, feel safe, learn these skills. They're not just different in the classroom, as their principals and teachers were sharing with us, but also at home, right? And so, what does that do in terms of the ripple effect it has on their social circles, right? Whether it's school or at home, hopefully with their friends as well who aren't in the program. So, really, that spillover effect. So, it's really exciting to know what you can do.
Very
Um,
exciting. Yeah. And so that it was a 10-week program you're referring to that someone that one of those kids was actually going through was a 10-week program.
Yes, yeah, all of those kids were going through a 10-week program, and then we heard back in terms of when we did interviews, and then some informally just volunteered that
Oh, is that right?
information.
And so
Yes.
do you partner, so as part of that was partnering with, was it partner mostly with the school board, or was it more with a healthcare clinic or
Yeah,
organization in that
some I
region?
we yeah, largely we because we do applied research,
Mm-hmm.
we draw from within Moses Weitzman Health System is Community Health Center Inc., which is the largest federally qualified health center, or
Mm,
FQHC, in Connecticut. Um, and so Weitzman Institute had been housed under CHC, but then we had a reorg given our national focus under Moses Weitzman Health System. And so a lot of our work is informed. That's why we say practice-based research network is sometimes how we refer to as the Weitzman Institute, because we really want to see what are those needs that our clinical colleagues at Community Health Center Inc. or CHCI and other health centers are seeing in their practice that they would love to address, but are having challenges, whether it be bandwidth, resources, including time, to be able to
mm-hmm.
address. And one of those includes childhood trauma, right? And so we know that for social determinants of health or social drivers of health, which is upstream, right? Beyond the four walls
Right.
of clinical practice, account for 80% of health outcomes that we see, right? And so we know that it might show up in the clinic, but the solutions may not be clinically based, right? There might be a need for clinical community partnerships, like which means partnering with outside entities outside of healthcare to be able to address certain issues. And then so for some, they might not have some patients, in this case pediatric patients, may not have a diagnosed mental or behavioral health disorder,
Right.
right? But they may have experienced some kind of trauma, right? Just
Sure.
because they haven't met the threshold for a certain disease or
Diagnosis. Yeah,
disorder
exactly.
does not mean that they are not at risk for it,
For
or
sure.
that there's, some kind of um, condition that they may develop later in the life course. And so, how do
Yeah.
we prevent it or intervene early, right? And so, that's what we're trying to do in terms of how do we support our clinical colleagues, knowing that not everything can be done nor should be done within the clinical setting. Some of it is
That's very interesting.
also because I think by virtue of the FQHC setting being so deeply ingrained in the community, is also seeing like what are our partners in the community, so other community-based organizations, what are they seeing, are they,
Mm,
because they were likely also serving similar populations, not just pediatric but also adult, who may or may not be seen in our clinics, right? And so how do we also look to them, because those could become potential patients, right? They may not
hmm.
realize that care is available, or there might be some kind of barriers to access. And so I think it's really that looking at the ecosystem in which our target populations live, breathe, and play, and learn and age, to be able to identify who can be part of these programs.
Yeah, I think that that's very interesting. The practice-based research that you talked about is that you're you're providing these programs to individuals in these communities, and at the same time, while giving while working with these kids in these environments, you're also gleaning information about what else is going on in these communities and
Mhm.
understanding where some of the other gaps are, and then finding ways to reach other areas even deeper in the community, which is really interesting because you're really creating a real branch or web work and root system of support, because through one group you're learning about another group, and et cetera down the line, and that's very interesting because you're bringing that all that hand frontline information back to you, and really working out how to dig deeper in there.
Yeah, I mean, Heath, our most recent example, just to build on the last project I was describing, I said some parents just volunteered information and just shared with us anecdotally. They weren't part of a formal interview per se.
Right.
They were saying, because you're focused on childhood trauma, they were saying, it'd be great if you had a program for parents to talk about these issues. And so
Hmm.
that's what led to what we now have in terms of addressing intergenerational transmission of trauma. And so now we're focused on parents and caregivers and giving
Right.
them the space to talk about these issues, which is not something that we've done formally in the history of the work of the Weitzman Institute, right? And so it's really interesting of like how one project and collecting data about it can lead to another idea of like, can it really be informed? Again, going back to the work we do at Weitzman, by the end user or the target populations, and not just something I learned in the classroom or saw in an article, right? Really being responsive to
Right.
the current needs and anticipated needs and priorities as well.
Yeah, that intergenerational trauma, as we're learning more and more, about, through historical reflection and reconciliation, and we're understanding that is actually, that's a real thing, and it's going back many generations.
Hmm.
And it's great that programs like yours are understanding that, and actually, like you said earlier, allowing like the parents to have a voice to say, oh, I have something to say about this. I'm great that my kid's in here, but I need some help too, or I know others that need help. And amazing that they find that space to be able to feel comfortable and safe to express that too.
Absolutely.
Amazing. Um, so that must be very fulfilling for you when you hear those things, and you kind of come back to your leadership role, and the big picture, and driving the organization, to hear those things, and again, like, reinforce that this is why we do this. This is what we're doing
Yes,
for
yes.
the world.
So that goes
Hmm.
back to what I was saying, that sometimes some of these wins are helpful to know given the
Yeah.
magnitude of the challenges that we're addressing.
Yeah.
Is that an important part of your work in growing the company? Is leveraging, or leveraging these stories, or these success, I would say, wins or success stories, on how what the impact is you're having at the front line of society.
Yes, so I think storytelling, and then this is something that we're talking more and more with our team in terms of really drawing not just on the quantitative piece, because sometimes you just don't have a large enough N or sample size,
Yeah.
right? But then the stories
Yeah.
are very powerful, right? Stories in the
Yeah.
front lines, stories of from patients and community members of how our work impacted them, right? Not just for our own morale, right? And to like pat ourselves on the
Yeah, for
back,
sure.
but
Yeah.
sometimes it's also to understand what didn't work, right?
Hmm.
Because we're very big on continuous quality improvement. And then sometimes you realize, you know what? That may have not been the best approach. Maybe we can address it a different way next time, right?
Yeah.
Or maybe we can consider that that works in this part of the country, but not in another part of the country. And so I think it's really helpful to lean into those stories, both from a morale standpoint, but also a growth perspective as well.
Well, those are the stories that I think validate, or maybe they validate, but also, demystify what's going on out there as well, and
Hmm.
shedding some light on things. So I think it does two things. It provides a way for you to spread the word of what Weitzman's is doing, but also shedding light on what the issues are and and
Hmm.
where the weaknesses in society. And so it kind of does both, at the same time. But I know people talk, well, I don't feel good about, you know, looking like we're capitalizing on people's stories so that we can, market ourselves and promote our brand. But yet that's the only way to continue to grow and have the impact that you're having is by sharing these stories so people understand what you're doing out there and how much progress you're making.
Yes. Yes, and then understanding Heath, because I'm still laughing internally about you're saying what's an FQHC, right? Because I'm trained in research, right? And the
Yeah.
way we joke around, the way that we're trained to share or disseminate our findings, one of the standards is peer-reviewed publications, right? And so there's a specific format, and you just, as my friend said, learn the recipe, right? What are the foundations of your intro,
Right.
methods, results, discussion, conclusion, right? That doesn't work for everybody, right? We would soon, having been in the practice space, having been with folks who are experts in their own right, but not research, they don't necessarily have time to read my
A few.
3,000 word or 5,000 word article,
No.
right? Nor will it be impactful. But to hear about, a single mother raising two kids who was able to have her kids be in our program and the impact it had in their home and her own well-being, right? To hear about, or our frontline providers, mentioned rural Appalachia, right, who feel so isolated in their practice and there's just so much need that sometimes it overwhelms them and they don't get to
Mm-hmm.
go, with their colleagues in the big cities to attend the latest course on X topic, right?
Yeah.
To know that we've been able to deliver that evidence and meet them where they're at, I think those are more impactful than my 3,000, 5,000 word articles. And
They are.
again, like just being able to use different modalities to have, the mission is still the same, the intent is still the same. It's
Mm-hmm.
just um, being
How you
more open
present it,
in terms
really.
of the way. Because
Yeah.
storytelling, as you know, Heath, that you're big on story, you have this
Yeah.
podcast.
Yeah.
Stories are universal, right? Is
Yeah.
from the beginning of time. And I think just making sure that we make this accessible to everybody.
And everybody hears or sees or absorbs information slightly different, right? It really
Yes.
depends on your perspective and where you're at in your own life and your own experiences. And so, sure, a lot of people would probably really love to read a 3,000 word essay, and because that's what they're also very familiar with, and they really they absorb and really soak that stuff up. And then others want to hear, they want to experience something, they want to feel something, they want to feel like, oh, I'm so glad this is happening, or or they have a relatable experience to somebody in one of those situations. And then you have other people that will want to hear it in another way. But it's important to understand that everyone receives that information differently, and it means something different to each and every one of us. So you can't tell stories, and there's not too many ways to tell a story. There's many
Mm-hmm.
ways to tell a story. Yeah. Interesting. So let's come back to you, and you're in your role. What is it about your leadership style that you think is most effective with leading your team um, when developing these programs and implementing them? Like, what is it about your leadership that you think has the most impact?
Mm. Knowing that, I remember working with my coach about this, and he was going over different levels of leadership. And then he said, there's the one on one where you invest in one person, but then there's exponential leadership where your investment in one then has a ripple effect and they're able to do all these great things. He probably explains it better than I do. But the premise is
No, I
knowing
get it.
that
I get where you're going.
if I've unlocked the strengths of my different staff, right? And really understood what makes them tick, what topics, what, is it project management in terms of skill set? Is it public speaking? Is it writing, right? And they get to work on those topics that they care about using their skills, then they thrive, right? It's not all dependent on April Joy. I remember my former employer, we used to talk about, if I get a run over a bus tomorrow, can this work continue? That was always a thought in the back. And I know it's very tragic in terms of
I use that theory a lot.
But it's really understanding, can this be bigger than April Joy? Because it is, right? This work is more important than me. It's more important than any individual within the Weitzman Institute. And it's really about creating this exponential leadership that I've tapped into other current leaders and emerging leaders, as we describe them, and the next generation of leaders, so that the work not only exponentially grows today, but also is sustained beyond my tenure. And so I think that's really exciting. And it also gives me a break, and it also helps other people grow in their leadership.
I like to call that
have such a larger impact.
I like to call that a legacy mindset, where you're thinking about what you've done so far to leave it behind. Doesn't matter. I mean, we're not talking about literally being hit by a bus, but if you move on to another opportunity, everything that you've done is still valid and usable moving forward by the people coming up from behind you, right? We're not always in the same roles or positions or companies or even living in the same cities, but the work that we do, we leave it behind. You say is kind of like you're building the legacy now, so that whoever is running this show from for the next decade, it could be even 100 years from now, what you did up till now is there, and it's part of the foundation, right?
Yeah. I would also say, Heath, I think there is value in being able to have staff cultivate joy and find joy in meaning in the work they do, right? They're not just these.
Well, Joy is your middle name.
It's my double first name, yes. So it's part of my name. So I have to live up to my name, right? But really finding meaning in work, right? Because I don't have the statistic, and it's not my area of expertise. But so many people just clock in, clock out, and it's a paycheck. It is what it is. But I really want the people I work with to feel connected to the work they do. And that might not be the entire team, but I, as much as possible, want people to find meaning in the work. And I think that only comes by trusting staff, working with them, but also challenging them to help them find what gives their work meaning. Because I think when you find meaning in work, then again, I've talked about our founders, right? Then whether it's rain or shine, you're still committed to that work, right? This is unwavering commitment to the mission and the work that is beyond me. Because if I'm having a bad day and you're just feeding into my energy, well, that won't work. But if you find your own meaning and you cultivate your own joy in the work, then it goes a lot further, right? Because again, I'm only one person and I'm also human. And so really having staff, particularly when they're earlier in their career, discover that, I think is just so powerful.
Was that infused in you from your past, from your parents, from previous work colleagues, or where did that come from in you to desire that for your staff, for your people?
Yeah, I would say I would say it's probably a combination. Definitely the foundation was laid by my parents, right? That's why I was saying, this old soul going on a retreat at the age of 8 and trying to figure out what's my purpose. And then after literally decades of being in school, entering the workforce and having both great supervisors and not so great supervisors. And I think we learn from both types of leadership.
Yeah, absolutely.
But then I think as an employee, right, as a direct report, one learns this is how I would like to be managed, right? I know how I thrive. And I remember my mom said, you know what, if it's not aligned with your strengths, you're not passionate about it, you're not making an impact, then what are you doing, right? Like, stop wasting time, right? We say this also because from both a spiritual standpoint, but we tend to have a shorter life expectancy on that side of the family, right? So it's like make the most of the time you have, and so stop wasting
Mm-hmm.
time and other people's time. But also learning that because I know what it's like to be a direct report, then that informs how I lead as well. And so, what would I want of a supervisor, right?
Mm-hmm.
And so I try to have that infuse what I do, and then I also get 360 feedback, right? And just say, is this working, right? Like that's my intent, but what was actual impact? And so I think
Right.
having those skip level check-ins to make sure is it translating because or is it just in my head right yeah, we don't want the emperor's clothes, that kind of
That's
situation,
right.
right.
Now you mentioned the C word, coach. You have a
Mhm.
coach.
Yes, yes, I've been
Yeah.
working
So
with for almost as long as I've been here. Yeah, 6 years.
is that right? So what do you see in the value of a coach? Is it executive coach or
Yes.
yeah? What do you see that and is that something you would recommend to others in a role like yours? How does it help you?
Yeah, just having we call so he and I talk about the container, right? Like I remember in one of my notebooks, and I had to draw it because he's like, yeah, "This is a safe space. We're talking about everything. Just put it out there, right?" And it's like, "Oh, you take it or leave it." It's not therapy, right? It was very clear. It's not therapy, but really, being able
There's
to
a thin line though.
thin line. But to think through different scenarios, right? Like, what are my blind spots, right?
Sure.
Just because you have
Yeah.
the title doesn't mean you stop growing or that you know it all, right? There's always opportunities to grow. And so I
Yeah.
just appreciate saying, okay, I tried this, that didn't work. Can we bounce around different approaches, right? Or like, how is that received? And so that's why I was saying intent versus impact. This is what I
Right.
thought,
Right.
right? Something as simple as, but I wrote it in an email. It's like, did you try picking up the phone and talking to your colleague? So that's a very benign, but some
It's a
of
good
these things
example because it's
can
a
go,
very often.
grow out of proportion over email, and you realize, what, I've been so dependent in this virtual environment, that picking up the phone and talking with them, that actually worked, right? It's a very minor example, but then just
No,
realizing the effects it had on my relationship with colleagues of just pick up the phone, right? Like make it more of an
personal.
informal, because sometimes emails and people are
Well,
it's just
because
not, again, going back to communication, people receive information differently.
for sure
So I think
everyone
just
can
being able
read.
to
You can
bounce
read.
ideas with them.
We read emotion into our emails. We don't
Yes.
actually because they actually don't have any emotion in them. And so if someone doesn't type it with any emotion, but they don't necessarily consider how they typed it, it just
Yes,
comes off a
yes,
certain way.
yes.
We'll read it and we'll be like, oh, I think she's mad at me, or
Yes.
I've done something wrong, or something like that, where it's like it's all inferred and it's like it's all in your head actually. But a phone call you can't get around that because you can
Yes.
hear someone's voice and you can hear how the tone is presented, and we'll also receive that email depending on whether we're having a crappy day or not,
Yes. Yeah,
right?
you
So
never
it's
know what the
important.
other person might be going through, and just
No,
trusting we're
we don't
all
know.
trying to do our best in any given moment in time. So yeah, it's been really helpful just to think through
What
those.
are tell me one of your challenges that that your coach has helped you with in your leadership role? Share one with me.
Yes, caring without attachment. He
Mm,
phrases it differently, and then he's gonna here's this recording. He's like, that's not how I phrase it. But essentially, sometimes
that's
I'm
a
so
good.
attached to a certain outcome, right? I want
Ah,
something to be a certain way. Maybe it's, you know, decades of being a perfectionist, you
mm-hmm.
know, and I sometimes mistake excellence and control, right? Like they're just interweaved, and it's gotten me so far in terms of life and what I've achieved, and I just assume that should always work in all situations, and then recognizing no, caring deeply without attachment, right? I'm like, oh, like I can do my best and trust that it will work out, right? Having faith in the
Mm,
process. And so I think that's been really challenging because sometimes the analytical side, right? Again, trained as a researcher. It's like, no, but this is, if I do this, then this is what's supposed to happen because that's the best possible outcome. And like, what other possible outcome could there be? And so I think that's been, it's still a work in progress, Heath, just to be honest, right? Because you just expect it to be a certain way and then to have those assumptions tested, right? Has been really humbling, but also freeing. I've realized that, like, oh, I don't have to have all the answers, and hey, there was probably a better answer, and I thought at the time that was the best
Right.
answer, and then you realize, no, there's a better outcome, and sometimes I don't understand it until weeks, months, years later, right? And so just the freedom of being detached from a particular outcome, um, I'm rediscovering in different situations.
That's good advice. I'm going to tell you, that's really good advice. I'm going to take it. I'm sure some listeners are going to take it with them too. So thanks for sharing that. So coaching, important part of your leadership development then as part of you as you move
Mhm.
forward. So think back 10 years. Did you think you'd be in this place, in this position 10 years ago or even 15 years ago? Or did you think you'd be somewhere else?
I knew I would be doing this type of work, right? Because it's just what I live and breathe, right? Like I focus on the health of vulnerable populations, right? I want everyone to be able to, well, that's how we start out the call, right? To be able to alleviate
Yeah.
human suffering and to ensure people across the life course are able to thrive, right? From the time they're born to the time they lay their heads. And so knowing that, oh yeah, I get to do that, right? And I get to work with other people who are doing that. And we get to use different modalities to achieve that shared mission. So yes, I knew I was going to be doing it. In what capacity, in what setting, um, that's where I really just had faith that it would work out, right? Because again, I've worked in the private sector, I've worked in government, I've worked in nonprofit and direct service. So I always, one of my friends, when before I moved back to the East Coast and went to med school, he did this motion with his hands, right? And hopefully your viewers understand. And I'm like, what is that, right? And then he was saying,
She's bringing her hands upward
yeah,
and up.
so yeah, and then he's like, there are different paths, right, but the same destination. And
Uh-huh.
so,
Converging.
yeah, so really knowing that, there are different ways I can serve the same mission, right?
Mm.
And so I didn't know of Weitzman Institute 10, 15 years ago, let alone right before I got here, right? Um, but I just trusted, and that's where again my faith comes into play, that I would end up in a place that would allow me to carry out that work and
Mm-hmm.
leverage my strengths. So yeah, yes, to some extent, Heath, I knew exactly the specifics of it, not so much, right?
Got it. I think that's a great answer. Is there anything about Weitzman Institute that you want to share that we haven't talked about yet? Is there anything that you want to recap for listeners, or something else that we haven't brought up?
Yeah, I'm just really excited about the work that we're doing, right? I mean, we talked about the social determinants or social drivers of health. We talked about workforce development, but also the innovation that's happening, right? Sometimes people, I've heard it often, even in my last conversation this morning, um, people sometimes assume that health centers, because of the shoestring budget or the populations they work with, there's not time or interest in innovation. And it's far from it, right? We're very much innovative in not just the types of research we do, how we do the research, the types of topics we address in our education programs, and the modalities we use to provide education, how we're providing thought leadership through policy. And so, really challenging those assumptions that innovation is not happening or can't happen in health centers, I think is
Mm-hmm.
really, or there's not an interest right now, right? Like they're just trying to keep the lights on. And so I think it's really exciting because sometimes it's when you're challenged and you have your back against the wall that innovation is birth, right? And so I think it's really exciting to be in this work where we get to be innovative, where we don't shy away from challenges, but really take a step back, look at our strengths, look at the strengths of our collaborators, see who's missing at the table, and really try to think outside the box. So I think that's just really important, because sometimes, again, folks think that that's just not happening. But to be challenging that those assumptions, things, no, innovation is, and it will continue.
Mm-hmm. And what's the growth trajectory for Weitzman Institute?
In terms of numbers or in terms of topics,
Yeah,
however
or
I
a
interpret.
combination of overall philosophy, maybe, or whatever. What do you think? What do you see for the future of Weitzman?
Yeah, historically we focused in federally qualified health centers, right, or FQHCs. Um, and I know we know that in addition to FQHCs, FQHCs are part of a larger health and social ecosystem,
Mm-hmm.
right? And so really knowing that there are there's a workforce and there's patients and communities beyond health centers in similarly situated communities, systems that face similar issues, right?
Mm-hmm.
And so, how are we expanding our audience in that way? I would say also in terms of topics that we're addressing, right? I know we didn't get to go into it as much in terms of the role of technology. We touched on innovation, but really expanding the types of topics that we're addressing and making sure that as innovation, tech revolution is happening in healthcare, that health centers and the populations they serve and the safety net aren't being left out, right? And widening those gaps between the haves and have-nots. Um, and I think the third, which I think is one of those top, again, is not a topic, Heath, that we really get to talk about. We're really training the next generation, right? Like, what does that look like? Um, Historically, we focused on patient-facing staff, right? Like, also knowing how are we training the next generation of researchers, of educators, of the C-suite, of policymakers who are also invested in safety net health systems and primary care in general. And so I think being able to expand how we invest in the next generation is also part of our growth trajectory.
That sounds wonderful. Well, April Joy, this has been an awesome conversation. I've really enjoyed it.
Likewise, thanks, Heath.
We're almost in we're just past 45-minute mark. So I know there's more we could talk about. So maybe you'll have to get in another episode or something. We can focus on on technology for that one, maybe.
Yes, yes, I would
But
love it.
what's if people want to reach out, or there's someone out here that's been listening that wants to work with Weitzman, and how do they reach you? How do they find the organization?
Yes, so our website is easily weitzmaninstitute.org, but you also can follow us on social media, and then you can also connect with me on LinkedIn.
Great. Well, I just want to thank you for your time today. I really enjoyed getting to know you, learning about Weitzman. You're doing amazing work, and thank you for doing that. And thank you for joining me today.
Great, thanks for having me.
All right, so that brings that episode to a close, and our conversation with Dr. April Joy Damian, and hearing about her work at the Weitzman Institute and her passion for mental health and public health. They're doing some amazing work in the community with their partnerships at community health centers, and are reaching more than 2 million people. And the restorative justice mindfulness projects that are giving young people new ways to heal from trauma is incredible. We talked about the power of storytelling, and particularly in research, it reminds all of us that behind every number is a real human story, and that can inspire more change and give that ripple effect that April Joy was referencing. And I really appreciated her sharing about how in her work, how caring without over attachment is very important. And I think that's something that a lot of us can relate to, particularly if working in an area that is a lot is a very passionate source to getting up every day. So great advice from her about that. Thank you to her for joining us today, and thank you for tuning in, and we'll see you next time on The Healthy Enterprise.